Hello, my name is Estefania Ramirez. I am going to talk about human papillomavirus complication. Definition: human papilloma is a viral infection that is transmitted mainly through direct contact with an infected person. It is the most common sexually transmitted infection in the world. Every year, more than half a million women in the world are diagnosed with cervical cancer. High-risk types of HPV can also cause genital and anal cancer in both men and women. Low-risk types of HPV can cause anal and genital warts.
There are an estimated 18.9 million new cases of sexually transmitted infections each year in the United States.
Human papillomavirus, HPV, accounts for about 5.5 million of these new cases. HPV can cause cervical cancer in women, as well as oral and anal cancer in both sexes. An estimated 90% of people who are infected do not show any symptoms. The best way to diagnose HPV in women is with an annual pap smear.
Certain HPV types are significantly linked to the development of cervical cancer. 40% of women who are infected with type 16 or 18 will progress to precancerous or cancerous lesions within a 2-year period. Early intervention can prevent the development of full-blown cervical cancer.
Prevention is key in reducing HPV. The HPV vaccine is a 3-shot series targeted primarily at young women 13 to 26.
Studies on the HPV vaccine have shown it to be highly safe and highly effective in preventing acquisition of human papillomavirus.
And yet it is estimated that less than 50% of young women have received the HPV vaccine. The Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine has been investigating why vaccination rates are low, specifically in the African American community.
The Siteman Cancer Center is really dedicated towards understanding cancer disparities within the St. Louis region. Our research indicates that a lack of knowledge could be a barrier to people getting vaccinated. We're trying to look at some possible interventions that give people the tools they're going to be able to need in order to make informed decisions.
Now that we have a safe and effective vaccine and better diagnostic methods and better treatments, cervical cancer should be a disease that we can prevent and should become a very rare disease in the future.
In men, genital warts most often appear on the penis, scrotum, in around the anus, or in the groin. You can get HPV by having vaginal, anal, or oral sex with someone who has the virus. It is the most often transmitted during vaginal or anal intercourse. Anyone who is sexually active can get HPV even if they have had sex with only one person. You can also develop symptoms years after you have had sex with someone who is infected. This makes it difficult to know when you were first infected.
When I recommend preteen vaccines, I recommend all 3 of the vaccines that we intend to do the same way, basically. So here are 3 vaccines that we want to do. I do give a little bit of information about each vaccine because that's my informed consent, just like when I talk about infant vaccines. So I can talk about all 3 preteen vaccines in about a minute and have my informed consent done at the same time, and kind of avoid the too much information thing. So this is how I present things to parents. Today there are 3 vaccines that I'd like to do. The first one is the meningococcal vaccine, which prevents a very, very rare but potentially very serious infection that could cause meningitis. And when it does, it's uniformly devastating and potentially really deadly. The second one prevents the HPV infection, which is extremely common. In fact, most of us get HPV in our lives and can go on to cause multiple different forms of cancers. That vaccine is given in a series of 2. The second one would be given 6 to 12 months from now. And then the last one is the one that most people know about. That's the tetanus booster or the Tdap, which vaccinates against tetanus, diphtheria, and pertussis, which is whooping cough. If your child gets whooping cough, they could have a bad cough for 2 or 3 months, which is not fun, but really the big reason that we vaccinate big kids and grown-ups against pertussis or whooping cough is to protect babies who could die from that. Do you have any questions about those? Usually parents don't. About 80% of parents say, okay, that makes sense.
Application in medicine. It is a non-therapeutic prophylactic vaccine that prevents infection, not cure. You are vaccinated against the capsule, not against the oncogenic proteins. Cellular immunity kills infected cells doesn't change, only antibodies are produced. The HPV vaccine is recommended at 11 or 12 years of age, but can be started at 9 years of age. For people who haven't been successfully vaccinated, HPV vaccination is recommended up to age 26. Diagnostic tests. Vinegar solution test. A vinegar solution applied to HPV-infected genital areas turns them white. Papa Nicolau test. Your doctor collects a sample of cells from your cervix of vagina to send for laboratory analysis. DNA test. This test conducted on cells from your cervix can recognize the DNA of the high-risk varieties of HPV that have been linked to the genital cancer.
HPV is a very common sexually transmitted virus that probably at least 80% of women have been exposed to at some point in their life once they have become sexually active. So this is an important virus for us to screen for, and some of the recommendations can be a little bit confusing to patients. However, we do it based on your age. And for women who are 21 to 30 years old, the only reason they would be screened for the HPV virus would be if their pap smear returned as a low-grade abnormality. The reason we don't screen for high-grade abnormalities is because we presume the virus is there. The good news for these young women is that the HPV virus will often resolve itself over a period of 1 to 3 years. So it's not something that they will permanently have in their system, and often the abnormal cells that go along with that can also be resolved over time. When women reach the age of 30, we do a screen for HPV regardless of their pap smear. So if they were exposed to HPV potentially in their 20s but never showed any abnormality on their pap smear and it's still hanging around in their 30s, it's something we may want to watch a little more closely. From 30 until 65, we'll screen women with a PAP and an HPV every 3 to 5 years if it's negative. And if it's positive, then they potentially will have an additional procedure to evaluate the cervix a little more closely.
Cons. There are two types of HPV condition: low rise and high rise. High rise one can cause these types of cancer: cervical cancer, cancer of the anus, some types of oral and throat cancer, vulval cancer, vaginal cancer, cancer of the penis. Second cause of death in women worldwide. Pros. Can be considered an advantage. The HPV vaccine is a cancer prevention. Issue applied in Ecuador. In a study, it is possible to determine that Ecuador women older than 30 years have cervical inheritance. According to data from the study, is was determining the genotypes of 1653 and 58 of the human papilloma predominate in women from the Ecuadorian coast. In the addition, 20 out of every 100,000 women suffer from cervical cancer in the country. The prevention conclusion: the prevention of human papillomavirus infection that undergone a significant change with introduction of vaccine against the virus, which has led World Health Organization to take action on also include in national vaccination programs to contribute to eradication of genital cancer not only in women but also in men. Thank you.